talking fast is something that I do a lot. So I need to slow it down, and I know that. So I noticed it halfway, like near towards the end, and I was like, okay, next question, I'll slow it down. It happened to be the last question, so that didn't really help. But if you have any advice that you wish someone would have given you going into PA school in the profession, what would it be?
First question is, can you tell me about a time that you struggled academically?
Yeah, so I feel like one of the biggest times I struggled academically was definitely during my freshman year of college. My freshman year, I took biology 2 coming in. The class itself was pretty hard, but I think that I struggled academically coming in my first year of college. I was also a student athlete. I was on the women's soccer team, Division 2. So coming in, the adjustment from moving to high school to also moving to college, but on top of that, time management with being a collegiate athlete, I think really made me struggle throughout the course. It was my first about 2 tests I didn't do the best on. I definitely didn't do up to my standard of testing. So after that, I started taking a lot more energy and putting it into the class. I went to office hours. My professor was nice enough during office hours. He went over our tests with us. He would tell us things that we can add, stuff to focus on more. Through that, I really did learn and kind of applied it through the rest of my college career to pay attention to detail and kind of learning everything as a whole instead of just memorizing it for tests. So I think struggling through that class really helped me throughout the rest of college and something that I'm going to implement in the future.
Okay. Switching gears a little bit to your experiences. In your description of your experience as a pediatric aide at Corewell Health, you said that you successfully bring positivity and smiles to patients during hardships. Can you tell me a little bit more about that?
Yeah, I'd love to. So I have a really big connection with the Royal Oak Beaumont Pediatric, especially the volunteer community. When I was younger, my cousin was diagnosed with brain cancer, and she spent a lot of her time in Royal Oak Beaumont. And that means we spent a lot of time there as well, in the hallways with her pretty often. And a lot of the volunteers were there for us and kind of just brought joy and hope to her throughout her time there, but also through us. They would bring us stuff. And so when that opportunity arose, I jumped on it really quick. So what I do there is I'm kind of the person that brings joy to their day. They get a lot of bad news throughout the day or just aren't really in the best mood no one really is when they're at the hospital. So I'm the person, I bring them toys, I'll sit with them, play cards with them, maybe go to the playroom with them, bring them stuffed animals, blankets, really anything that they kind of need to make their time there more comfortable. And I've noticed that coming in, positively smiling is something that they might not experience every time that someone walks into their room. So doing that has really shifted the way that I look at healthcare experience, and just anytime I'm with a patient, that's something that I brought into my job, even as a medical assistant. And I plan to bring in my job as a future, because I think that just smiling and a positive attitude can really change the trajectory of any experience.
Good. Can you tell me why you think you'd be a good fit for this program?
Yeah, so this program, I feel there's a lot of different aspects of it after doing a ton of research and talking to a lot of different web people in the webinars, as well as some current students in the program that really fit with my vision for what I want in the PA program and for my future. This program is very, very, per a student that's actually in the program right now, is a very collaborative compared to a comparative or a competitive program. And that's something that I think I will thrive in very well. I've been in group settings as long as I can remember being in sports, as well as a lot of different leadership opportunities, encouraging people and really lifting people up. And that's something that's really promoted throughout your guys' program. And I think that's something I can add. I have a lot of experience with it, and it's definitely going to be some of the hardest times that we go through. So having people that can encourage each other and bring each other up is going to be something really important. But I also really align well with the program, just the goal of creating physician assistants that are going to want to do their best and treat patients and then give back to the community as well. That's something I've been very active in since I was younger. My mom actually spent her first years of her profession working for a nonprofit in Detroit teaching kids math. So growing up, she was very big on us giving back to the community. We've been very active in our parish, giving back. Recently, I spent a lot of time giving back to my home school district. I volunteer throughout Anchor Bay through their food program in the schools in general, and I love giving back to them as a whole. I spent a lot of time in Detroit doing life builders and kind of building back the community, and that's something that has really touched home to me. So having a school that is really big into giving back, especially within my home community and home state, is something that I think I'll align really well with.
Just give me a few seconds after each response to kind of type some notes.
You're good.
So previously, you mentioned that you bring smiles to the kids, blankets, things like that. You want to do that as a physician assistant in the future. You think that's very important. And you did that as a medical assistant. Why did you choose to work as a medical assistant at the ENT office?
So ultimately, my main goal was to work as a EMT through MedStar, but the timeline of the class and the program for it really didn't work out in my favor. I would have had to wait a couple of months, approximately like 4 extra months, to start working and getting patient care experience. I really was really eager to get into working right after graduating. So when that opportunity presented itself, I jumped on it. I also do love the aspect of medical assistant and getting to interact with all the different patients and kind of get to listening to their stories. And I've learned so much through that experience that I'm really grateful that I ended up going that route. Talking to patients all day, it really solidified also my decision going to PA school, really getting the connections one-on-one with patients. It really, in my words, I would say, kind of showed the connection that you can make with a patient. And that definitely is something that I'm really passionate about. I love getting to know people, but through that experience, I did notice the scope of practice I had as a medical assistant, and I strive for the scope of practice as a PA in the upcoming future. But I've learned so many things there that I'm really grateful I took the experience, specifically listening and active listening to kind of through your eyes, more of people's mannerisms in terms of if they're not having a good day or if they're going to get bad news. I learned how to notice that and kind of how to comfort them through talking to them. So being a medical assistant, I was actually really grateful that I got to do that.
Can you define success?
That's a very good question. I think success can have a lot of different definitions. To me, success would be setting a goal and taking the steps to achieve it. I think that some goals are going to be very long term and some will be very short term. So setting or success to me would just be achieving a goal that you set for yourself.
Final answer?
Final answer, success is achieving a goal or really achieving as much as you can. I know that's a very tough question.
It's okay. We can move on.
Yeah.
Can you tell me about a time when you were criticized unfairly?
I will definitely have to think about it. I'm not sure if unfairly is the word. I think that every kind of situation has perspectives where from one perspective it may be unfair, but from the other it could be justified in their side. So seeing both sides is definitely, I think, big and important in every situation. But if I had to define a time, I would say in my job as a medical assistant, our office is pretty unique. We have 2 in Wisconsin and then 1 in Michigan. So our main general manager is located in Wisconsin. So we don't spend a lot of time with her or see her pretty often. So recently there was a time where I received an email making sure to, every time someone comes in for either like a mole, lesion on their skin, to make sure in the physical exam that we document in millimeters, the size of it, the color of it. And that was criticism in a way because I wasn't doing it, and she kind of pointed that out. Having her not in office, we were never trained to do that. But with that circumstance, I took a step back and I looked at it, and instead of being frustrated and kind of looking at it in a way where she never told me, I just took the criticism, have applied it a ton recently. We've actually seen a lot of that recently in our office. So I've just made sure to do exactly as asked and proceed from there and learn from it.
Okay. Let me see if there's anything I haven't asked you quite yet. There we go. Okay. Can you tell me, in your role as a medical assistant, when you had to deal with a difficult patient?
Yeah, so difficult patients tend to come around pretty often, I would say, different in different circumstances. So there's one patient that tend to come in pretty often for the same reason. This patient in particular would come in for some sinus issues. After coming in, we prescribed them medication. This patient never seemed to pick up the medication or use it, so would come in with the same symptoms and complaining about not getting any better. I would have talked to him, ask if I was the one that had to give the bad news that the patient did not take the medication once again. Over and over this happened. But as my role as medical assistant, I would get his information, talk to him about it, get his symptoms, and he'd come in pretty frustrated. But I think that with my strengths, like I explained, kind of coming in with a positive attitude, he wouldn't come in the best mood. But after talking to him in the room for a little bit, definitely made his encounters a little bit better, because bringing a positive attitude and talking to him kind of calmed him down throughout the time in comparison to just keep getting mad. He would end up leaving in a good mood, but then the cycle would tend to repeat itself.
Okay, and then this is me as the interviewers, not just me as me, asking, do you have any questions for us?
Yeah, so I guess for my circumstance, two different. I have questions prepared for like when if the PA's kind of questioning me, and then for the interviewers. So I'll separate them.
Both.
Okay, if you were the PA, one of my biggest questions would be what you decided to specialize through school and why you decided to go to PA school in general. And then my second one would be if you had any advice that you wish someone would have given you going into PA school, what would it be?
Can you repeat that last one real quick?
Yeah, if you have any advice that you wish someone would have given you going into PA school in the profession, what would it be? And then the ones for the interviewers, like more the admissions board, for me would be why did you decide to go or to start teaching in this program compared to any other program or staying working in the field? And then also, what feedback are you getting from your current students about some of their favorite things about the program?
Okay. High pressure portion is over. How'd you feel?
Okay. Definitely a lot of different questions than I've been like looking at. So I think that's a good thing. I think that I think this is good because this is really my first like interview for this that was someone I don't know other than like my mom and myself. So talking fast is something that I do a lot. So I need to slow it down, and I know that. So I noticed it halfway, like near towards the end, and I was like, okay, next question, I'll slow it down. It happened to be the last question, so that didn't really help, but something that I know. I think that this is something I had questions for you about in general of sometimes you don't know what they're going to ask. So being able to tie in things that you want them to know. So I feel I did that because I wasn't sure what was going to be asked. That was definitely a question I was going to have for you in general after all this was, is it important to tie in like that type of stuff, even though it might not be directly related to the question?
What type of stuff exactly? What do you mean?
So like different stories, I would say, and then things that I feel are important. So in your question of kind of why I felt like I would fit best for the program, highlighting some of the things that I like about their program more than just like why I'd fit well in the school, but kind of why and what I know about their school.
Yes. You want to answer the question you want to answer, not specifically what is asked.
Okay. Yeah. I feel like I did that in this because I wasn't sure what was going to come up later.
That's good. Yes. You definitely want to answer the question you want to answer. You want to find like excuses to say good things about yourself and excuses to tell good stories.
Yeah.
And take it in the direction you want to take it while still respecting the question.
Yeah.
And then sometimes it's going to be kind of a gotcha question. Like anytime something is negative, we're trying to get you.
Yeah.
For instance, tell me about a time there was a difficult patient. The wrong answer is, yeah, there's a lot of difficult patients.
Yeah.
You want to have more empathy for those folks.
Yeah.
You could say some patients, sometimes do take more effort than others in certain ways. For example, this one guy is non-compliant as hell, but you know
Yeah.
what I mean? That was kind of a trick, but we'll get to that. Yeah. So
Yeah.
yes, my answer is yes. You do want to include things that were not specifically asked for. You don't want to be a robot and just be like, okay, I'm going to answer your question exactly and shut up.
Yeah.
No, it's a conversation. It's an individual thing.
Yeah.
So yes, 100%. Did you have any other quick questions before we get to the specific questions and feedback?
Kind of more specific to two. One's more specific to my situation. When I was kind of looking over everything, like in the end, some people say like, oh, is there anything you want to add? I kind of have two different sides for this point. So being an athlete through college, I don't have like a long timeline on my application. It's
What do you
pretty
mean?
short, like experience wise. So like patient care
Okay.
experience, volunteer, it's really, I would say, been like a year. So I don't know. I figured because like you get the interview, like it's fine in their eyes. I didn't know if I should highlight like the reason for it if they don't ask.
I don't see why you would, because that's kind of like a weak point you would consider.
Yeah.
So why would you want them to think about it?
Yeah, that's what I figured, but I was like, I don't know. And then the other one is, I know sometimes certain like people that interview you might not have read like your application or your personal statement.
It could be
like
blind.
in the school. Yeah. I'm not sure how it's going to go, but do you have any advice of like how I would know if they have or not?
Sometimes you won't know because it could be general questions like define success.
Yeah.
Sometimes you'll know for sure because they'll say, hey, you in your application said this, this, and that.
Yeah.
That's the easy way to know. The overall answer to this is doesn't matter.
No, not really. That my only thing was because do I tie in things like that? Oh, like they would know that. But I think I'll just answer everything
I wouldn't
general.
worry about it.
Okay.
I wouldn't worry about it because even if they did read your application, they're interviewing 20 people today.
Yeah.
They're not going to remember every single nuance. They're going to do exactly what I did. They're going to take like 20 minutes, just glance over it,
Yeah.
get a good idea, see if anything really weird pops out that they want to ask about, and move on.
Mm-hmm. Okay.
So I wouldn't worry about it.
Okay, perfect. Yeah.
Now, as far as talking quickly, because usually I actually have fewer questions than this, and usually it still does go 20 to 30 minutes, and we were done in 13, so I started asking more questions than I even had. So it was quick, it was brief. Things could have been expanded upon more.
Mm-hmm.
I did feel like you answered things well. Okay, so here's my main feedback for you. Overall, global. I feel like you do everything well.
Mm-hmm.
That's its strength. We want you to do things well.
Yeah.
With people like you, I want you to show some vulnerability, some like I am human kind of situation, because some people have a tendency to be like, oh, you're perfect, screw you.
Yeah.
So you want to kind of get ahead of that and like be like, no, this was really hard for me.
Yeah.
Like, yes, I have essentially straight A's, but like that's so not everyone's going to ask you like, where'd you struggle academically? Because you obviously haven't. It's like the results, but you want to kind of go the other way.
Okay.
You want to show that you're human, that you're that like humility, that you're humble. You want to kind of make yourself seem a little bit more humble.
Yeah.
Does that make sense?
Yeah.
So you do still want to be very confident, which you are. Like every question I asked you, you're like, yeah, absolutely. Until we got to some of them where you were like, that's a good question, and then you like stumbled.
Yeah.
Which is, it happens once in a while. But overall for you, I'd like you to show more examples where you are kind of struggling and then how you overcame it.
Okay.
Yeah. You have plenty of examples like that, probably.
Yeah, I've definitely struggled.
Life hasn't been perfect, right? You've struggled.
No. Yeah, definitely not. No.
You twisted a knee in a game and had to miss a month of practice and it sucked. Or, you got an A in this class, but your first 3 tests you failed.
Mm-hmm.
Or X, Y, and Z. Like you've had struggles.
Yeah, definitely.
I would highlight those a little bit, bring some in because your transcript and your application has none.
Okay.
So it's like, it's good. It shows a lot of confidence, but you want to be a human.
Yeah. Definitely.
Does that make sense?
Yeah, it does.
Is that feedback you were expecting?
No, not really, because I feel like being talking human. I know in person too, I feel like I connect well with people. So
Sounds
you
like
can
it.
feel human, but I see that you need to that you struggled and you have before in the
Mhm.
past
Is this in person or is it online?
in person.
Thank God. Okay, good. Because you're obviously good in person, so that's
Yeah,
going to be good. They're going to notice the eye contact. They're going to notice the empathy.
yeah,
Uh, but yeah, bring some things up where you struggled, and like, don't just be all businesslike about it. Actually, show some emotion.
yeah,
You know what I mean? Like, be human.
yeah,
Okay. So that's that. And also read the room, depending on like if it's someone who looks super strict and there's like a 50-year-old doctor who's obviously like extremely just like wants prestigious stuff, yeah, okay, maybe be perfect. But if
yeah,
there's like some lady who looks warm and maybe she's like just a little tiny bit portly and she
yeah.
obviously like has struggles in her life, be more human. Like
Okay.
adjust that.
Yeah,
Okay. It sounds kind of stupid, but you want to know your audience,
yeah,
right?
definitely. Yeah,
So yeah, know your audience. If the guy's like super duper strict and everything is perfect, okay, fine, follow along like you're in the military. But if
yeah,
she's like just trying to be done with this formality and just wants to connect.
yes.
Fair.
Hopefully, I'm hoping that's what it's like because I feel like I
Everyone's
tried.
going to be different.
Yeah,
Everybody will be different. Sometimes even in the same room.
yeah. So I feel
Like,
like I could have the chance where like one of like the PA might be like just wants to have a conversation, but the admission
mhm.
person wants to just be strict. So
Yeah,
I feel like, yeah,
yeah. So you kind of might have to do both.
yeah,
Like, yes, sir, absolutely. And oh my God, I was playing with this kiddo in the same room, like two
yeah.
different. So yeah, be malleable, but be very human, be very humble. Let me share my screen so we can actually talk about the questions specifically.
Okay.
And also, my other kind of piece of global feedback is to give more specifics.
Okay.
Specific examples. How did things look? What did you actually do that makes it more memorable?
Yeah.
So, like I said, I think I already shared this with you. I didn't because I didn't want you to know your own questions. So now I can share it with you.
No, I think you did, but I didn't look at it because I didn't want to look at the questions.
I took it back
Oh, okay.
immediately after sharing because I realized I didn't want you to look at the questions. Is this you?
Yeah.
So I might have to send this to a Gmail account for you to be able to see it. But we'll get that. We'll cross that bridge if we need to. All right. So that's just basically general advice for all different kinds of interviews.
Yeah.
Moving on to your own questions. So this is what I actually got from the website and from what you talked about. Handwritten responses within 30 minutes. We talked about this.
Yeah.
Okay. Overall, very confident. I think showing humility, overcoming weaknesses and setbacks would be good, especially for such a strong applicant, and adding more specifics. So we're going to get into that.
Yep.
So these are not in order. Tell me about a time you had to deal with a difficult patient. Anytime there's something that's remotely negative, tell me about a time you struggled, when you were criticized unfairly, when there was a difficult patient, when anything bad. My rule of thumb is overwhelming empathy for the person that is the problem or the situation, and overwhelming responsibility upon yourself.
Okay.
Okay?
Yeah.
So in this case, difficult patients come around pretty often. I wouldn't have said that.
Yeah.
One patient keeps coming in for the same reasons, never seems to pick up his medication, and then they leave in a good mood, but then the cycle repeats.
Take out the negative. Yeah.
Don't be negative.
Yeah.
Maybe mention it as the motivation and then take all this responsibility and what you learned and what could have done better and this kind of thing.
Yeah.
So, yeah, I wouldn't also label people. Like I label people in the question, deal with a difficult patient. I want you to not do that.
Okay.
I want you to say like, so, the good thing about medicine is it's never the same thing every day. That's why I really like it. But that also means some patients are going to be more difficult, requiring more effort than others. Some are going to be straightforward. Some are going to require some more work.
Yeah.
For instance, I'm glad that you used an example. This is good. We had one patient that was a little non-compliant and was known to be. He would come in with the same sinus issues, but we would notice he didn't really pick up his medications as often as we'd like. I wouldn't say never. And then, he would have the same complaints. And some people got frustrated because they felt like they weren't able to help him. And I was kind of in that boat. I really want him to stop suffering. And also, he seemed to be like frustrated, understandably. You can't breathe. You'd be frustrated too, wouldn't you?
Yeah.
When he came in. But I tried to reemphasize to him that, look, this medication will help. If this doesn't, there are other modalities, but we want you to treat this, this way first. And I feel like I was able to lighten his mood, and I was really happy about that. So obviously I'll be able to help him more as a PA, maybe suggest different treatment modalities, maybe even surgery. Maybe he had polyps, I'm not certain, but there's more things I could do as a PA, but I'm glad I was at least able to lighten his mood and remind him to take his medications.
Yeah.
Is that a better response?
Definitely. Yes.
Cool. Do you see exactly what I'm doing?
Yes. Baking in a pot. Yeah.
Yeah. And maybe even something super humble like, maybe I could have done something better. Maybe obviously I was not reaching him because I've interacted with him a number of times. So maybe I could have done something better to make him more compliant, maybe explain the mechanism of action in case he was afraid of the medication, maybe ask him about his concerns about possibly taking the medication,
Yeah.
something like that. What I could have done better. Tell me about a time you struggled academically. I'd be shocked if they asked you this because you haven't by your transcript.
Yeah.
But they might because we want to hear you. Like we want to try to break the veil of this perfect student. Obviously, she's not perfect. Like something had to happen. But what did you say? What did you actually say here?
I talked about biology too and struggling in my first really 2 tests of it, but then I improved it.
Yeah, you said you started paying attention to detail, going to office hours. So that was good. I want to go one level above that, below that, a little more specific.
Mm-hmm.
So I started paying attention to detail, which means what exactly?
Oh, are you asking me now?
Sure. What does paying attention to detail mean to you?
For me, I would say it's more not just memorizing the concept, but learning how it all works together and how every detail kind of comes together so that you're not just trying to pass the test, but I'm really trying to understand it.
I think that's still at the same level. Go one level below. What exactly does that mean? So does that mean like this was biology 1, biology 2?
2.
Can you remember a specific area of content where you did that?
Not off the top of my head right now, but I'll definitely think about it.
Yeah. I like to try to use as little general statements as possible or start with a general statement and then go more specific.
Yeah.
Like all throughout high school, I feel like I was just studying for the grade, but in this class, I finally realized that might be possible on paper, but I realized I really need to know this content.
Mm-hmm.
So instead of just memorizing things, which I've been pretty good at, I started going to office hours, talking to the professor. How does this actually apply? Blah, blah, blah. But it would be better with a specific example.
Yeah. The only example right now that's the only thing I really remember going through was during a test we talked about. We went through kind of the feedback of it. And I remember him telling me, I don't remember exactly the question or what it was. I think it was about cells, but we were talking about how he's you could add the color of this into the detail to make it more detailed. That's one of the biggest critiques that I had from him, which was an interesting test. Yeah.
Okay.
But I'll think more into it and find it a specific.
Yeah. Sorry, I don't have anything specific here.
Yeah.
My feedback is use more specifics, and I don't have one for you.
Yeah. But, that's okay.
The best way that I've heard this one answered, and I usually recommend, is when people change their study methods.
Mm-hmm.
Instead of just memorizing a list of things, they actually draw out diagrams. They remember in their head what certain things look like, that kind of thing.
Okay.
And then when they get to the test, they remember everything, maybe how it's applied, maybe even tie it to your experience. We were looking at epithelial cells, and then I realized that, histology is very important when you're understanding disease processes, something like that.
Okay.
But a little bit more specific if you can, even just a little tiny bit more of a detail.
Yeah.
This one, again, I'm not exactly sure what they will pick out, but anything that stands out even a little bit. So this one was kind of unique, and it was also one of your shorter experiences, which if someone's trying to get you, they're trying to get you stumped, they might ask about one of the most limited experiences because they might think you'd forget about it.
Yeah.
Right? If something has 3 hours, it's oh, did you just put that in there to stuff your resume? Let's see if you remember this.
Mm-hmm.
Not that they necessarily will, but it's also, I'm trying to give you they call it a story bank, 5 or 6 good stories from your experiences that can be applied to anything.
Yeah.
And I think working with kids is certainly a good story bank.
Yeah.
So I actually really, really like this. You were specific in this one. I brought them stuffed animals. I brought them blankets, coming in positively and smiling. I really like that.
That one I like talking about that because it is really special to me. So that one I typically have examples for.
This is how I want you to talk about everything.
Okay.
Specifics. What did you do? Smile. Be happy about it. What you learned.
Yeah.
And projecting into the future is good. I don't think it was this one, but there was one where you said like listening to people and like understanding what they mean with their eyes and everything. That was really, really good.
Yeah.
I like that one. Why do you think you'd be a fit for this program? After doing a ton of research and speaking with current students, I love that. Very collaborative rather than competitive. How so? Where I thrive in encouraging, lifting people up. Again, how so?
Mm-hmm.
So how is it collaborative?
Oh, I know they were saying that, but also even through like the webinars that they said, how they have like collaborative through all their professors and kind of just all their missions of everyone. They're really there for each other, open for support. I know they said in one of their webinars how they pair each person up with their mental health provider, and they make sure they meet with them to make sure everything's still going good through the program, and like to make sure, because it's definitely going to be hard, stressful change of a lifestyle. But also they study together. They really just meet together. They're pretty much together all the time, studying and then helping with each other is what the student said compared to the webinar as well.
So it's like a tight knit group. Is it a smaller program?
I think they take 50, so smallish.
Medium size.
It's growing more than it was.
Yeah, but it's small. It's not like a 1,000 program or 1,000 person program. 50 is you're going to know everybody's name within the first couple of weeks.
Yeah.
If you like the size of the program, some programs are 70, 80, 100 students. This one's like middle range to where you can find your own crew, but it's collaborative. You could say that specifics again. You could say how you talk to current students, and they said that they always study in groups, which is great because it just makes you feel like you're not alone going through something like this. I like the sports example, why I thrive, as in sports, and then you just ended it. I'd say soccer is a team sport. I don't run track. I love that in soccer, we're a squad. We do everything together. We train together. We eat together. And that's what I think this PA program is going to be like. That's what I've heard from current students. And I thrive in that environment. That's why I'm choosing this one.
Yeah.
Why do you think you'd be a good fit? Maybe some kind of value that you would bring to it. Not just, why you're choosing the program, but why they should choose you.
Okay.
So encouraging, lifting people up is important to me. Why are you a good fit? So what is something that you would bring to this program?
I feel like if they asked that, I would tie in to stay with that topic if I was talking about it. Just really like my leadership as well through soccer. I was a captain of our college team from my sophomore year up. So it was really my job to kind of bring people together and encouraging them for our one goal, just like how in PA school, we have one goal to get through it. In sports, we have one goal, whether it's a game or just get through practice. And that was really one of my biggest roles, was to encourage people throughout the hardest times, to kind of be there, lift them up when hard times arise.
How? See where I'm getting at?
Yeah.
A lot of people have this tendency. They describe things.
Yeah.
And then that's it. It's like an introduction sentence with no meat.
No body, yeah.
No body of the paragraph. It's just an introduction.
Yeah.
So what's the actual body paragraph here? How do you lift people up?
To talking to them, really just giving them supportive advice, messages, being there to help them when they need it, whether that's studying together or really just, I guess, kind of encouraging when times are low. I feel like that's sports-wise. I would to encourage them, positive words. If they did mess up, really just kind of encourage them more with change it into a positive. Say that you're gonna overcome it next time. You're gonna make the shot next time. Don't worry about it. Brush it off. A lot of those phrases was encouraging. And then another side of not encouraging was really bringing everyone together. It was my job to create different what's it called? Group events when we first joined the team.
Okay.
All of that was really my job. So we were trying to plan like a trip up to a cabin. It fell through, but we did a lot of different team dinners. It was my job to organize, cook, bring everyone together. Halloween parties, Christmas parties really was what I did. So I think I'll throw that in there as well. Bringing people together outside of the PA school, as well as just like we did outside of practice, kind of getting together.
So out of all of that, I got two very important examples that I think you should focus on if asked something like this.
Yeah.
So remember, for the story bank, you want to get this example and you find an excuse to use it.
Use it.
So the example is like, why are you a good fit for this program, or what value will you bring to this program, or why should we choose you? You know, besides your record, obviously, is well, I think that my leadership and organizational skills that I learned as being a team captain playing soccer really help. For instance, encouraging people when they've messed up, which inevitably happens. So, for instance, my one teammate Jessica, or wait, you're Jessica. My one teammate Amber, you know, missed a goal and she was very down on herself. And it was my job as co-captain or as captain to really encourage her to understand that, look, I know the goal of the game is to win and to make goals, but sometimes you miss, sometimes you fall down, and it doesn't mean you're a bad player or a bad student. It doesn't mean you're not going to make it. It just means that you have to get up, next play, figure out what you could have done better, but we're going to get up, we're going to keep moving. And we're all going to mess up, and it's good that we're going to be there together, but I'm going to bring that energy to the program. Also, another thing I did was I organized events because it's not all about, you know, soccer. We would have a lot of stress factors if all we did was play soccer. So the things we do outside of that is very important. I organized a lot of dinners where people just get to sit and eat and relax. And that brought us closer together and made us better as a team, which I think will be better as a class too.
Okay, perfect.
Fair?
Yes, very.
You know how specific that is?
Yeah.
Could you do that?
Yes.
Cool. With whatever examples you truly have. I just kind of made those up.
Yeah.
Yeah. So let's do that. Let's continue sharing my screen. But yeah, your responses are all fine. I'm just trying to get them to be not 6 out of 10. I'm trying to get them to be 8 out of 10, 9 out of 10.
Yeah.
Make me feel and remember something.
Yes. Remember.
You don't want to like enter the room and then just be forgotten immediately. You want to do something memorable.
Yeah.
A bunch of soccer players sitting at a Buca di Beppo eating and laughing and whatever, or a girl missing a goal and crying about it. That's something I will remember. You make a general statement.
Yeah.
And it's gone. Right? So get your memory bank and just be ready to get specific stories.
Okay.
Why ENT office? You know, it's your only big experience. So that's probably something to be asked about because it's important, especially since there's really no questions about your academic record. I'm not certain I would have said this. Like I wanted to be an EMT, but it didn't work out. And I was really eager to start. I know it's true. I wouldn't necessarily say this.
Okay.
You know, I would probably say something along the lines of like, you know, I was pre-PA. My end goal was PA school. And I was looking as fast as as hard as I could for opportunities. And this opportunity came up. It was the first one. I really liked the doctors and the PAs there. So I jumped on it. And then the rest of your response was perfect. It allowed me to interact with patients, make connections. I'm passionate about that. Made me really want to be a PA, increase my scope of practice, active listening through someone's eyes. I loved all of this.
Okay.
I wouldn't necessarily like if there's something they don't need to know, why would you say it? Like, do
that
they
was my first choice, yeah.
Is this adding anything?
No.
This is like, well, I wanted to have a higher level of involvement in patient care, but I didn't because I wanted to hurry up.
Yeah.
Yeah, probably wouldn't say that.
Okay.
I wouldn't say I was eager to get to work. I would just say, you know, I needed patient care hours. I knew I needed medical experience. This is the first thing that popped up, and I'm really glad for the opportunity, and then go into this.
Okay.
Also, you're going to get really, really tired of me saying this, but specific.
Yes.
I learned active listening actually through people's eyes, like their day isn't going well. I could pick up if somebody's day isn't going well before they even say anything, and I would kind of change how I interact with them, maybe ask them how they're doing before going right into their medication list. And sometimes even just that, like 1 minute to just let them vent or let them talk about the long wait time. They just felt better and they were more agreeable to the treatment plan and that kind of thing.
Okay. Yeah.
It's one sentence, but it shows me not just, okay, I learned active listening.
Yeah.
Cool.
Yeah.
Through people's eyes, good, a level beyond that, but now bring me into the room with you. What did you do? Yeah?
Yeah.
And then the rest is perfect. So this one I'd call an 8 out of 10, but let's make it a 9.
Yeah.
This one you got stumped.
Definitely. Yeah.
A lot of people get stumped on this one.
That's one, yeah, I definitely haven't thought of or heard, but I definitely will now.
So why do you think you were stumped on this one?
I feel like maybe because it doesn't have like a direct answer. I feel like success is very measurable, and like individualized to everybody.
Mm-hmm.
Because success can, I feel like in my mind, like can mean so many different things, like success of a goal or success of your future. So I feel like I just didn't know how to word it well.
So one thought that comes to mind is you're trying to be a science major, and I need you to be a philosophy major here.
Mm-hmm.
I also need you to be vulnerable and say personal things. This is an interview. They already know your application is solid. They already know you get the right answers. Now they want to know you as a human.
Yeah.
You know, did you by any chance watch my interview with Dr. Palferman, the program director at Rutgers?
No, I haven't watched that one. I've watched a lot of your other like mock interviews and everything, but not that one.
I would definitely hear what she has to say. In fact, I'll link it right now.
Okay.
It's like an hour and a half long, or actually I think even 2.5. Don't watch the whole thing if you don't have time.
Yeah.
Or like watch it while you're going for a jog or something.
That's what I've been doing, is watching them when I'm walking.
That's a great idea. I mean, you just have to listen. It's not like there's anything on screen that's remotely important.
Mm-hmm.
Let me see. Rutgers, I want to say. So one thing that she brought up that I thought was extremely valuable that I never really thought of. There it is, 2.5 hours. Oh, shut it. 1 second. I did not just tell her to shut it. 1 sec. She's an awesome, awesome wealth of information. There we go. So I just linked it in the private chat. Click on that, save it, watch it. The reason for that, the one point that she really brought up that was amazing was she really likes for people to get as personal as they're comfortable getting in the personal statement and in the interview. Because in the program, everybody, I don't care how good of a student you are, everybody struggles. Yeah. Everybody has personal issues that make them struggle. So death of a parent, rolled ankle, just mental breakdown, whatever the hell, everybody experiences something that's like 10 out of 10 bad, just because you're under so much stress. And when that happens, you need to see that coming a mile away, and you need to talk to your faculty so that they can kind of accommodate you instead of talking to them after you fail 2 tests and you're out of the program.
Yeah.
And the reason for that is you need to have good relationships with your faculty. So if you are comfortable being that vulnerable right away, not freaking oversharing.
Yeah.
Not like, I'm not going to come up with a stupid example, but not oversharing, not being annoying, but being comfortable, being vulnerable with the faculty, because you're going to have to be.
Okay.
Okay. So questions like this, anything that's very, very personal, is a good time to start showing them that you can do that.
Mm-hmm.
So define success. There's no right answer. It's not going to be like, well, success is taking steps to achieve a goal. Yeah, that's a dictionary definition.
Yeah.
But what we want is, what does success mean to Jessica? Right?
Yeah.
Success to Jessica. Yeah, what does success mean to Jessica? Like, if you woke up in 1 year, what would your life look like that would make you happy right now?
I feel like, I guess something that I do believe success, ultimately success is kind of not based by like a measure, nothing of like wealth. For me, it's really like happiness in a way. Mm-hmm. There's a lot of things I feel like that I've gone throughout my life that could push you, like definitely make life harder. But, and I guess my mom's always taught me like to be like successful is to be like happy, to have like a support system, loved, is I guess in my way like happiness. But I'd have to figure out. Yeah, I don't really know how to word it.
What would make you happy? Please never say getting into PA school.
No.
That's my last interviewee, who was also a college soccer player, literally half an hour ago. That was her answer to this question.
Huh.
And I try not to repeat questions, but like this one stumps everyone, so I always try to use it as an example.
Yeah. Happiness for me is like, I don't even know how to define me happy. Like having a family, having, I guess like happiness, like family, really just can get through my day and just be like myself and do what I kind of want to do, and have people there that support me and that I love and that they love me. I don't know. I feel like that's something I definitely have to think on.
We got somewhere. We got family. Family is part of your success. It's not just because a lot of people wouldn't say that.
Yeah.
A lot of people would say a Lamborghini in the driveway and a $3 million house on a lake and whatever. You're saying family. Okay. That's the first thing that came up for you, right?
Yeah.
Is that why you want to be a PA and not a doctor?
No. Family, I feel like it's just like built into like me and like who I am, like big for me. So,
Why?
growing up, I lived, so that was like in my, if they ask like, oh, like, who are you? That's definitely a big thing like throughout my story. So I grew up across the street from my like first cousins,
Oh,
all
wow.
the way up until my third and fourth cousins all live within our neighborhood or 20-minute drive away. So like for me, especially like right now, I know my brother's struggling with it. Like he's having a wedding and they're like, you have a huge family, but not because like size wise, but because I see like my fourth cousin once a month, which is not something that's very common. I know that. So like family for me is like ingrained really big. And then also after, so age of 12 for me, my cousin passed away from brain cancer at the age of 15.
I'm sorry.
Thank you. But that's definitely grown like our closeness of our family, really the value of family to my life.
So do me a favor. Whenever you watch this feedback, I'm assuming you will.
Yeah.
Check your vibe when you just said all of that compared to the entire rest of the interview.
Okay.
You're expressive. You're not just dead on looking forward. You're looking like you're a human being.
Yeah.
That's what they want. This is a personal thing. This is a interview. They're trying to get to know you. They're not trying to get to know your resume anymore.
Yeah.
So that I feel like I finally understand a little bit about what you're all about. And it's also the first super unique thing you said.
Yeah.
I live across the street from my cousins, and also my fourth cousin I see once a month, which most people don't even know they have a fourth cousin. Family is extremely important to me. People think I have a big family, but it's really just because the family we have here is super close. We see them all. They all live together. You're not Italian. Schneider's super German, but like, it's almost like we're Italian. Like
basically, yeah.
Maybe don't say that. That's stereotypical, but you know what I mean?
Yeah.
Like, talk about things that are important to you. Success to me is staying close with my family. It's like, that's interesting. Nobody says that.
Yeah.
It was kind of cool. I was actually really lucky to grow up across the street from a lot of my family, and everyone else lives within 20 minutes away. Our family reunions are weekly. They're not yearly. We do this together. We do that together. We go to swings and things. Or wait, no, that's in Ohio. The last one was from Ohio. That's why I'm still thinking that. But specific examples, exactly what's important to you, why. So success to me is, staying very close to my family. I know it's going to be hard during school, but I'm going to make time. They're extremely important to me. Having a family of my own, one day that I can support and have time for. That's a good answer.
Okay, perfect. I feel like when you hear the question, I feel like I'm like, okay, like define like success in general, not like I have to think of it like success to me, like what success looks like for my future more than just like the word success.
If you could answer every question that way, what that is to you, that's what I want.
Okay.
This is not the ACT. This is not define success in one sentence or less. This is define success for Jessica.
Okay.
Right? The whole purpose of this interview is to basically catch your vibe, get to know you. And it's the exact same thing for all of this. Do you have any questions? Oh, maybe not that one, but when you were criticized unfairly, you don't actually have to say, yeah, this was totally unfair. Let me tell you about it. That's like you want to be positive again.
Yeah.
Probably a bad example. Why did you choose to work at an ENT office? Well, I thought it was good experience for PA school. No, this was a good opportunity. I was very happy. I learned this. ENT, I wasn't super passionate about ENT specifically, but it just was an opportunity. Or, my grandma had a gigantic polyp in her nose and she was always complaining about it. So I wanted to help people like her. I don't know. It's something personal. You know what I mean?
Yeah.
Why are you a good fit for this program?
Yeah.
I did this. I was that. I felt good when I was able to support this girl who didn't make the goal. I hope I'm making sense here, right?
No, you are. Yeah.
Good. Tell me about a time you were criticized unfairly. Again, negative, and you're trying to steer away from anything negative, take responsibility, and have empathy for whoever kind of the target is. Also, it's much better to stay silent for a second or say, can I have a second to think instead of,
Yeah.
I'll have to think about it.
I've definitely thought about like, constructive criticism, that kind of question, but never like with unfairly thrown into it. So I feel like that was part that I was like, I've really never heard that.
This was actually in a question bank because I usually say like, tell me about a time when you struggled academically or tell me about a difficult patient encounter, which I did both for you. But But yeah, this one was just in a question bank that I picked out that I thought was good.
Yeah.
But essentially, they're all the exact same question. Tell me about a time that was bad, take responsibility, have empathy, move on.
Yeah.
Every situation can be justified as both sides, as an MA, blah, blah, blah. This is a lot of background information, which I'm not certain if is necessary.
Mm-hmm.
I got an email to share, blah, blah, blah. I felt this was criticism with the manager not in the office I was trained on. I don't know. This is a little confusing to follow.
Yeah.
Proceed from there and learn from it. I don't know. I don't love it. It was okay. Like, there was definitely nothing terrible. You didn't say, like, my manager was a biatch. I can't believe she sent me that email. It was so strongly worded.
Yeah.
She didn't even train me. Like, you didn't go that far. It was fine.
Yeah.
But
clear it up, concise it, and make
it. Don't say, like, as much detail unless it's super necessary.
Mm-hmm.
Like, it doesn't matter that she's in Wisconsin. The fact of the matter is you weren't trained to do this thing, and now you're asked to do this thing that you were not trained on.
Yeah.
And again, bring it to Jessica. How does Jessica feel about that?
Yeah.
Do you feel helpless that you were not trained and now you have to do this thing that's important to patients?
No, not necessarily. I feel like this is one of the most recent things that like has happened with like a supervisor or criticism for myself. I obviously want to say this in an interview. I'm like thankful enough I don't run into a lot of problems with like my supervisors, my bosses. So coming up with an example is definitely more difficult for me because that doesn't seem to happen pretty often, thankfully. So I feel like that's just an example of like recent at my job that has happened. So maybe I need a better example, but
yeah, I'd like you to have one or two examples of something like this in your story bank with just the right amount of details and how you felt about it, because you want to, like I said, kind of not appear perfect.
Yeah, have a story, yeah.
Yeah, and be ready to talk about it. So, like, this is a fine example. I would just give a little bit more detail, I guess. Not detail that you don't need, but like what exactly happened. I'm still a little confused. Like, you're supposed to measure moles. You weren't supposed to measure moles before, and then you felt like you weren't trained.
We just never, like, we were never told to do it in a way. So, like, for one of our doctors, we scribe, and for the other person, we don't. So for the doctor that we scribed, well, for both of them, we weren't really told to do it. But then we got an email that was like, you need to have this in the physical exam. Definitely wasn't worded the nice. She's not the greatest person with her words.
Right.
But so they basically told us, like, we need to be doing that. Things are getting denied because we aren't. But they never really told us that we had to do that or where to do it. So it was like kind of a shock, but it was pretty easy to figure out. But so since then I've done it, but we just were never told to, but then basically we're like blamed for everything getting denied because we weren't doing it.
Yep. And the only part of that I'd want you to share is the actual situation.
Yeah.
So like not, things are getting denied because we're not doing this, not that it was unfair, not that we were never trained, but kind of work that into a better way to say it. I'm trying to think of how I would say that now that I have all the details. But unfairly criticized. So, okay, how about this? Well, I think that from my experience as a medical assistant, it's very important to have clear expectations for what you expect from, people that you're working with. And part of my duties as a medical assistant at the ENT office is to document certain very basic physical exam findings before the provider actually sees the patient. And one thing that, one of the providers really wanted, but unfortunately was not communicated, or maybe I missed it in an email. That was my fault. I should have been more thorough in checking my emails before going to work. Is they really wanted moles documented, size, character, because it could be melanoma, which would be terrible for the patient, of course. So it came out in an email that I wasn't doing something that I was supposed to be doing. And I felt terrible that I could be putting patients at risk and also creating more work for the providers. So since that email, I've been doing that as often as I could. And I realized how important it is, but I still feel bad that I just wasn't doing what I was expected to do.
Okay.
Boom.
Empathy, yeah. Kind of
See what I'm doing?
Yeah.
Overwhelming empathy for the wrongdoer or the person who was the problem, and overwhelming responsibility upon yourself.
Yeah.
And after we stop recording, I'll tell you a very good example of exactly why they want you to act this way. Because as a provider, everything's on you.
Yeah.
In medicine, shit rolls uphill, not downhill.
Yeah.
Which means the one who is licensed is the one who's responsible for everything. It doesn't matter what it is, which is you as a provider. And then, all right, any questions for us? What you decided to specialize in and why in PA school? Like, which specialty appealed to you the most? in PA school, or how did you choose the specialty that you're working in now? It's pretty good. What advice would you have to someone, the profession in general? This is kind of general.
Yeah.
One kind of rule of thumb is you don't want to make them think too much, because they've had like a bunch of interviews already and they would rather do something simple.
Yeah.
So if you spell it out for them, what advice would you have to someone going into the PA profession is super general.
Yeah.
There's a lot. And if I'm already exhausted from interviewing 10 people, I don't want to think that much.
Yeah, that's fair.
So something more specific, like what was, when you were in PA school, what was a tough subject for you? Like, was it pharmacology? Was it clinical medicine? Was it anatomy? Like, what was the toughest thing for you? And was there anything that you like specifically learned that made it easier for you? Did you go to the lab more? Did you start making different kinds of note cards? Like, what really made a difference for you studying this topic?
Okay.
That's a good one for literally anybody, faculty or provider.
Yeah.
This is probably the most basic question in the world. Why did you decide to start teaching this program? Which you could do some variation of it. I just hope you don't ask it in the way that everybody else does.
Yeah.
So I don't know if you could think of something specific about the program, but I probably just wouldn't ask such a basic question.
Yeah, pardon me, because I was trying to think of specific things, but there was like a lot of things that I would ask that like I've learned from their webinars. So, like I know the answers to it. Like what's like even, or could I like ask something more in depth like about it? Like I know a lot of things that make them stand out from any other programs. So I wouldn't ask that because I know the answer to it.
You could expand upon it because you never know everything.
Yeah.
If you watch the webinar, that would be a great thing to reference because you actually cared enough to watch the webinar.
Yeah.
And then reference to something that you heard in the webinar. Like, one thing I really like about the school that I learned from the webinar and the website is X, Y, and Z. What do you think about X, Y, and Z?
Yeah. So like, because I know I add the other one, which I don't know if I'd ask both or if I'd change it based on this, like the feedback you're getting. I know they do a mentorship program between their first year and their second year. So they pair you up with someone going into their second year. So I could ask and be like, have you guys gotten any feedback of how helpful it was being paired up with someone in the second year PA school going into the program? Any of the feedback on that? Because that's something I feel like I don't hear pretty often that they do.
So do you have any feedback? Is it very general?
Okay.
So you could start with, like, I really like that you guys have a mentorship program where second years mentor first years. I think that's extremely important. And then something about that. Like, was the mentorship program implemented recently? Has like retention and pass rates improved since this happened?
Okay.
Or if they don't know, then whatever, but it's still a great question.
Yeah.
Because I think it's a great idea. And, have you noticed like improvements in retention and lower attrition rate and higher pass rate since this program was implemented? And they probably won't know because it's probably been around forever, but still.
Yeah.
It's a great idea.
Okay.
Also, I watched the webinar myself, or at least like little bits of it. And it was towards the end where the clinical coordinator was like, you might have to drive a little bit further, and I don't care if you hate me for it. I want you to graduate. Say that you thought that was funny and ask maybe like, what's the furthest place in Michigan, essentially almost Canada, that someone had to drive to?
Okay.
Did they have to drive a snowmobile to their rotation? Was it like a small town? Just like, what's the furthest place that you've heard of a student having to go? And then have a very, very positive attitude about it. Like, I think it would be fun to go to a small town and also maybe right in the middle of Detroit. It would be cool to have a variety.
Yeah.
Show that you're going to be one of those people that's easy to work with and not someone complaining about, oh, why do I have to go there? Well, because you need to graduate, and that's why we have a rotation.
Yeah.
So communicate that, because that's kind of like an insider tip. My program director or my clinical coordinator was constantly getting complaints like, oh, why do I have to go 40 minutes away? Why do I have to go 6 hours away? Well, because that's where we have a rotation.
Yeah.
So demonstrate a good attitude about that, and they'll be like, this one's good. We like her.
Yeah.
So this would actually be a great question. I just made this one up based on that webinar, so steal it.
Okay. Perfect.
Right?
Thank you. Yeah,
absolutely. And I think I shared this with you, right? I might have to share it if you have a Gmail, but yeah, so that's essentially it. One second. Let me stop the recording because it has to kind of upload.